Stop for a moment. Before you go to bed tonight, you need to hear this. If you make just one of the mistakes I'm about to explain, your heart may not survive the night. And the most dangerous part is this. Most people over 50 make several of these mistakes every single evening without realizing it. I know that sounds dramatic, but stay with me because what I'm about to share has the potential to save your life. Tonight, I'm going to show you the silent habits that damage the heart while you sleep. The ones that don't cause pain, the ones that don't trigger alarms, and the ones that rarely give second chances. And more importantly, I'll show you what you can change before your head touches the pillow. Let me start with a story that still weighs heavily on me. A man in his late 60s came into my office for what he believed was a routine visit. He was active, still driving, still working part-time. He described himself as doing pretty well for his age. His blood pressure was slightly elevated, but not alarming. His cholesterol was borderline, but acceptable. When I asked him how he was sleeping, he shrugged and said something I hear far too often. Not great, but who does at my age? That sentence right there is more dangerous than most people realize. 2 weeks later, his wife found him unresponsive in bed. No warning, no chest pain, no emergency call in the middle of the night. Just silence. When I spoke with her afterward, she said something that broke my heart. He told me he was just tired. We thought it was normal. Here's a truth that is rarely explained clearly enough. Your heart is not safest when you sleep. In fact, for many adults over 55, nighttime is when the heart is under its most dangerous kind of stress. Not the loud stress you feel during exercise or emotional moments, but the quiet kind. The kind that builds slowly, silently, while you're unconscious. During sleep, blood pressure shifts, breathing patterns change, oxygen levels dip, and small habits that seem harmless during the day can become life-threatening in the dark. I'm Dr. Adriana Nurse, and for decades I've studied what happens to the heart at night. I've reviewed thousands of cases involving sudden cardiac events during sleep, fatal rhythm disturbances, and heart attacks that occurred without any daytime warning signs. And what I can tell you with absolute certainty is this. Most of these events are not random. They are the result of preventable mistakes people don't even know they're making. The first mistake is extremely common, and almost everyone believes they're doing the right thing. Going to bed dehydrated. Most people, especially seniors, intentionally stop drinking water in the evening because they don't want to wake up to use the bathroom. That sounds logical. It feels practical. But inside your body, something very different is happening. When you're dehydrated, your blood becomes thicker. Thicker blood is harder for the heart to pump. Circulation slows, blood pressure regulation becomes unstable, and the risk of clot formation increases. Now here's why this is so dangerous at night. Between roughly 2 and 6 in the morning, your heart rate naturally slows and blood pressure fluctuates. That combination, thicker blood and slower circulation, is exactly when heart attacks and strokes are most likely to occur. I've had countless patients tell me they avoid drinking water after dinner because they think they're protecting their sleep. What they don't realize is that they may be putting their heart at risk instead. This doesn't mean you should drink large amounts of water right before bed, but completely avoiding fluids for hours before sleep is a silent danger. A small glass of water, about half a cup 30 to 60 minutes before bed, can make a meaningful difference. It helps keep blood flowing smoothly during the most vulnerable hours of the night. But hydration alone won't protect you if you're making the second mistake, and this one has to do with how you sleep. The second mistake is sleeping completely flat on your back when your heart can no longer handle it. Lying flat feels natural. Many people have slept that way their entire lives, but as we age, the heart's ability to manage fluid shifts changes. When you lie flat, fluid redistributes toward your chest. This increases pressure in the lungs and makes it harder for the heart to pump efficiently. For people with high blood pressure, early heart failure, or even undiagnosed weakness, this can be dangerous. Let me ask you something important. Have you ever woken up in the middle of the night feeling short of breath or felt the need to sit up to breathe more comfortably? That's not anxiety. That's not just aging. That's your heart struggling under nighttime conditions. I once treated a patient who slept with multiple pillows under her head. When I asked why, she said she didn't really know. It was just the only way she felt comfortable. Her body had figured out something her mind hadn't. Slight elevation of the upper body reduces strain on the heart and lungs. You don't need to sleep sitting upright. You don't need expensive equipment. Even a gentle incline of a few inches can significantly reduce nighttime cardiac stress. But posture won't protect you if you're making the third mistake. And this one is among the most overlooked and dangerous of all: taking the wrong helper before bed. Sleep aids are incredibly common. Over-the-counter products, nighttime pain relievers, melatonin, and prescription sleep medications are often seen as harmless, but many of them interfere with breathing, lower oxygen levels, or disrupt heart rhythm, especially in older adults. I've reviewed countless cases where someone passed away peacefully in their sleep, and when we looked deeper, a nighttime medication played a role. The most dangerous part is this: these medications often don't cause obvious symptoms. You don't wake up gasping. You don't feel pain. Oxygen levels simply drop or heart rhythm becomes unstable, just enough to trigger a fatal event. People often tell me, I only take it when I really need sleep. Sometimes once is enough. This risk is even higher if you snore loudly, stop breathing during sleep, or wake up feeling exhausted despite sleeping for hours. That's why the most important question isn't just, does this help me sleep? It's, this safe for my heart while I sleep? If the answer isn't clear, that's a red flag. But medication isn't the only thing people overlook at night. The fourth mistake is something many have learned to ignore: dismissing nighttime symptoms you've grown used to. Humans are incredibly adaptable. We normalize discomfort. We tell ourselves poor sleep, loud snoring, night sweats, or morning fatigue are just part of getting older, but your heart doesn't adapt the way your mindset does. Loud snoring, gasping during sleep, waking up with a racing heart, morning headaches, or extreme fatigue are not just sleep issues. They are signs of nighttime cardiac strain. One of the most dangerous conditions related to this is sleep apnea. Sleep apnea causes repeated drops in oxygen throughout the night, forcing the heart to work harder under low oxygen conditions. Over time, this dramatically increases the risk of heart attack, stroke, and sudden death during sleep. What makes it so dangerous is that many people don't know they have it. The person sleeping has no memory of breathing pauses. Often it's the partner who notices. Ignoring nighttime symptoms doesn't make you strong, it makes you vulnerable. And all of this leads us toward the final mistake, the one that ties everything together and often determines whether the heart truly gets rest at night. But before we go there, understand this clearly. None of these mistakes feel dangerous in the moment. That's why they're so deadly. They don't hurt. They don't scare you. They simply set the stage. And what happens next? The final mistake is something almost everyone underestimates, especially in the quiet moments before sleep. Now we come to the final mistake. And in many ways, this is the one that determines whether all the others become deadly or not. Because even if you hydrate properly, adjust your sleeping position, avoid risky nighttime medications, and stop ignoring warning signs, there is still one habit that can quietly undo all of that. The fifth mistake is going to sleep with a stressed heart. Most people think of stress as a daytime problem: work, bills, family issues, arguments, bad news. But what very few people understand is this: the emotional and mental state you bring into sleep determines how your heart behaves for the next 6 to 8 hours. Your nervous system does not shut off when you close your eyes. If you go to bed tense, anxious, angry, or mentally overstimulated, stress hormones like cortisol and adrenaline remain elevated. Your heart rate stays higher than it should, your blood pressure fails to drop into its normal nighttime dip, and your heart never truly enters recovery mode. I have seen this pattern repeatedly. Patients whose tests look acceptable during the day, but who develop dangerous heart rhythm disturbances only at night. When we investigate further, the common thread is often not diet or exercise. It is unresolved stress carried straight into sleep. One patient told me, "Nighttime is when my thoughts get loud." That was exactly when his heart was under the most strain. Your heart is designed to slow down at night. That is when repair happens. That is when inflammation decreases. That is when the nervous system shifts into restoration. But it cannot do that if your mind is still scrolling, worrying, replaying conversations, or anticipating problems. From the heart's perspective, stress does not care whether it comes from a physical threat or a mental one. The body reacts the same way. This is why heart attacks, strokes, and fatal arrhythmias are so common in the early morning hours. The heart has been working all night without true rest. Eventually, something gives. And the tragedy is that most people never realize the connection between how they felt before bed and what happened while they slept. Now, here's the good news. And this part matters. This mistake is one of the easiest to fix. It does not require medication. It does not require equipment. It does not require major lifestyle changes. It requires a decision to create a buffer between your day and your sleep. Think of it as giving your heart permission to stand down. Even a simple window routine of 15 to 20 minutes can dramatically change how your heart behaves overnight. No arguments, no heavy conversations, no alarming news, no bright screens that keep your nervous system alert. Dim the lights, slow your breathing, sit quietly, stretch gently, pray, meditate, or simply breathe slowly and deeply. When your breathing slows, your heart follows. That is not philosophy, that is physiology. I often tell patients to imagine they are speaking directly to their heart before sleep, saying, "You're safe now, you can rest." It may sound simple, almost silly, but your nervous system responds to signals, not logic. Calm signals produce calm responses. Now, let's step back and look at the bigger picture, because this is where everything connects. None of the 5 mistakes we've discussed are dramatic on their own. That is exactly what makes them dangerous. Skipping water in the evening, sleeping flat, taking a pill to help you rest, ignoring snoring or fatigue, carrying stress into bed. Each one quietly increases nighttime cardiac strain. When several of them happen together, night after night, year after year, the heart eventually reaches a breaking point. The people who suffer sudden events in their sleep are rarely reckless. They are not ignoring obvious danger signs. They are doing what they have always done. And that is why awareness matters so much. Once you understand what puts your heart at risk during sleep, small changes can have outsized effects. So let's make this practical for tonight. Before you go to bed, do 5 simple things. Drink a small glass of water earlier in the evening. Not enough to disrupt sleep, just enough to support circulation. Adjust your sleeping position so your upper body is slightly elevated, especially if you have ever felt short of breath at night. Question any medication or supplement you use to help you sleep and ask whether it is truly safe for your heart. Pay attention to nighttime symptoms you have been brushing off as normal aging. And finally, give your heart a calm transition into sleep. These are not extreme measures. They are gentle corrections, and they matter because sleep is not just rest. Sleep is a test. Every night, your heart is tested under lower oxygen levels, slower circulation, and shifting pressures. The goal is not to make that test harder than it needs to be. I want to leave you with one final thought. When something goes wrong during sleep, there is no warning bell. There is no chance to push through. That is why prevention matters so much more than reaction. The heart does not announce when it has had enough, but the opposite is also true. When you support your heart properly at night, it becomes stronger during the day. Blood pressure stabilizes, heart rhythm steadies, inflammation decreases, energy and mental clarity improve. Nighttime care is not separate from heart health, it is the foundation of it. So here is my question for you. Which one of these mistakes sounds uncomfortably familiar? Not which one scares you the most. Which one feels like something you have been doing without realizing it? If this video made you think differently about how you will sleep tonight, I want you to do one more thing. Share it with someone you care about, a spouse, a sibling, a friend. Because the most dangerous heart mistakes do not happen in public. They happen quietly in the dark while we sleep. And sometimes awareness alone is enough to save a life.